Charlotte Maxeke is in a good state of preparedness, and we are continuing to build on and escalate our readiness.
We put up tents last night, essentially for screening patients. It's out in the open, so there's good ventilation, so it's safer for patients, especially if we're working with bacteria and viruses that are going to spread.
What we know now about COVID-19, it's caused by a virus called SARS-CoV-2. It started out in a city in China called Wuhan. The first case in South Africa was a gentleman in KwaZulu-Natal. He's part of a group that returned from Italy. Part of that group, there was the first patient in Gauteng, which was treated at our hospital here.
So the patients essentially come into this first tent, which is for them to fill in all the documents. It helps us to trace whoever the contacts were. This is what we're giving the patients to go home, as self-isolation instructions and what to do. So this is also being used at all our Gauteng hospitals. We've given it to everybody, and we've said change your logos, adapt it for your facility and use it.
How many beds do you have in isolation?
They are consolidating patients, joining patients in different wards, so that he's been able to create more beds for us. So this is our resus area and everything. We've got kits. We've set up kits for intubation. I'm having special Perspex cages made from someone in the community. And then Prof. Mohammed has looked at the nurses' assembly hall as extra stretcher capacity if it goes really hectic.
I think that's a good plan.
So we've got the backup plans.
Touch wood that
we don't need it. We've tried to bring everything down to one area.
Okay.
We're trying to be inventive. We might need resources
To
like
say we
stretchers
might-
and stuff like that.
Yeah.
And that I think the army surely will have stuff to supply
We
instead
don't
of
need
us.
fancy beds, anything. We just
Stretchers.
need those ordinary
No, my
tent
problem is
stretchers.
that, you know what, after this we must be left with something that we can point back and say our capacity
Has increased.
actually has went
Yeah.
up.
It sounds crazy, it's 2020 and we should have some sort of fancy medicine, some sort of vaccine to prevent this, to treat this, but we really don't.
We're working on a lot of extrapolated knowledge from other countries.
Yeah.
So we actually get a lot of things that in retrospect now we've adjusted our policy to reduce. So given the alluvia or the lopinavir ritonavir, okay, which again, looking at other studies, probably not too effective. And then the chloroquine, which seems to be working, and in conjunction with the azithromycin.
There's some evidence to suggest that chloroquine is
I saw that.
but apart from that, the evidence is quite poor, but it's the best evidence we have.
The other important thing, we just need to document it properly, so that when we look back, we must be able to say we have moved and improved our
Contribute
service.
to everyone's knowledge.
Yeah.
We've been preparing for this since mid-January already. So we have all our processes and protocols in place.
I'm Mr. Malbati. I'm the infection control head of department here in Charlotte Maxeke. I'm here to do a test for COVID-19. It's very important for staff to know their status in case of this COVID outbreak, so that they can self-quarantine themselves or get isolated from other staff members.
Efforts can only happen because of the contribution of every single staff member who's been involved. The doctors, the nurses, the matrons, the cleaning staff, the porters, the security.
We had a good morning with our staff here in Charlotte Maxeke. One of the good things about it was just to also appreciate the treatment that we have been giving to our patients and our preparedness in terms of screening and testing, and also in terms of hospitalization. They've done well, they've done an amazing work. And we also went to speak to the clinicians who were responsible to one of our patients that was hospitalized and also in high care. And also they've reflected on a very good outcome from that and their experience. And we also insisted that they need to document so that we can have a story to tell after this.